Celiac disease is a chronic autoimmune disorder where the surface of the small intestine is damaged by a protein called gluten. Celiac disease is characterized as a malabsorption syndrome, more specifically as an absorptive defect of the gastrointestinal tract. This means that the intestinal mucosal transport system is impaired due to a primary defect. In the case of celiac disease, the primary defect is the inappropriate immune response by the body to ingested gluten and gluten-related products. Gluten can be found in wheat, rye, and barley products. The accumulated damage gluten causes to the intestines can eventually lead to a variety of symptoms and result in an inability of the intestine to absorb necessary nutrients such as proteins, fats, carbohydrates, vitamins, and minerals. Celiac disease is estimated to affect approximately 1% of the entire population, and it can develop at any point in time during the life in genetically susceptible individuals. The exact cause of celiac disease is unknown. However, the pathogenesis of the disease is thought to be related to genetic, environmental, and immunologic factors. Individuals with celiac disease have the genes HLA-DQ2 or HLA-DQ8 located on chromosome 6, which are known as the celiac genes. Patients with these genes who ingest gluten activate an abnormal inflammatory reaction in the small intestine. CD4 T cells in the body produce cytokines, which cause destruction of the absorptive villi from the lumen of the small intestine. Villi are the small finger-like projections that line the small intestine and promote absorption. A biopsy specimen from a healthy subject's small intestine would show abundant villi, which would look much like a shag carpet, whereas a biopsy of an individual with celiac disease shows loss of villi with flattened mucosal surface. Eventually, this can lead to lesions in the small intestine, which, when extensive, can impair the absorption of essential macro and micronutrients such as fats, proteins, carbohydrates, vitamins, and minerals. This process commonly occurs in the small intestine because this is where exposure to the protein gluten is the greatest. Populations that are at a higher risk of celiac disease include those with type 1 diabetes, autoimmune endocrinopathies, and those with first or second degree relatives with celiac disease.
Anatomy and physiology. The classic signs and symptoms of celiac disease is diarrhea, abdominal pain, malabsorption, vomiting, abdominal distension and pain, and inflammation of the GI tract. This occurs between the age of 6 to 24 months after the introduction of foods containing gluten. The inflammation damages the villi, in which they become shorter and flattened. Some may be asymptomatic or commonly known as silent celiac disease, and these individuals essentially have the antibodies that are common in celiac disease. Young children may also have signs of suboptimal growth, failure to thrive, and irritability, while older children may have symptoms of joint pain, weight loss or gain, and fatigue. So continuing from the previous slide, on the skin we can see dermatitis herpetophorus skin lesions, or severely blistering and itchy rashes. We can also see delayed puberty and easy bruising. In the bones, there is a decrease in bone mineral density or osteoporosis, short stature, dental enamel defects, iron deficiency anemia in which iron therapy does not work, low serum albumin levels, hair loss, mouth ulcers, numbness and tingling in hands or feet, depression, anxiety, recurrent infection, and irregular menses. How the celiac disease is acquired. So it's typically when the child has a family history of autoimmune disorders. So 90% of those with celiac disease carry DQ2 halotype, which is a human leukocyte antigen, while the other 10% carry DQ8 halotype. Either is a risk factor for celiac disease. So DQ2 is found in white individuals of Western Europe, Middle East, Central Asia, Western and Northern Africa, while DQ8 is commonly found in those from Northern Europe and Latin America. And this may be related to other immune diseases like Turner syndrome, Down syndrome, and Williams syndrome. So how celiac disease is transmitted? So typically it's through genetics, essentially is ingesting anything with gluten, so for example medications, food containing gluten, and etc., and transferring from hands to mouth if the hand touches anything containing gluten. How the celiac disease is prevented. So this includes maintaining gluten-free diet, reading food labels. The child may be referred to a dietitian who is specialized in treating children with celiac disease. There aren't any specific medications that are used to treat celiac disease, and those with anemia may take iron supplements. Another option is developing a care plan that includes a list of food that the child's allowed to eat and not allowed to eat. Also, like providing a list of foods that the child is allowed to eat to individuals such as like teachers, family, etc. And if the child has dermatitis herpetiformis, dapsone may be prescribed to control the symptoms. It is an oral medication, and scheduled blood tests may be done to check for any side effects of the medication.
Celiac disease progresses from a latent to active state when gluten-containing foods are first consumed. The Marsh classification is used to diagnose celiac disease and the amount of damage that has been done based on the amount of gluten that has been consumed. Marsh classification is broken down into 4 types. Type 0 is a normal state of the intestinal lining. Type 1 shows an increase in the number of intraepithelial lymphocytes, which are lymphocytes that reside within the epithelial layer of the mucosal and barrier tissues. This can be seen in those with celiac disease who are on a gluten-free diet. However, it can also be seen in those with dermatitis herpetiformis, and can also be an indicator of gastroduodenitis caused by H. pylori, hypersensitivity to certain foods, infections, medications, Crohn's, common variable immunodeficiencies, and IgA deficiency. It is therefore not specific for celiac disease and thus cannot be used to confirm celiac disease in a patient. Type 2 is rare and is seen in those with dermatitis herpetiformis. There is an increase in the number of intraepithelial lymphocytes, which is seen in type 1. The crypts, which are short glands found between villi in the small intestine, are also larger. In type 3, the changes found in type 2 are seen in addition to shrinking and flattening of the villi, indicating that atrophy is occurring. This is what is typically seen in symptomatic celiac disease. There are 3 subsets of type 3 based off of villus atrophy. They are partial, subtotal, and total. The way to avoid progression between these types, especially between the 3 subsets of type 3, is to partake in a gluten-free diet. If left untreated, celiac disease can lead to a variety of other health concerns, such as other autoimmune disorders, such as type 1 diabetes and multiple sclerosis, dermatitis herpetiformis, anemia, osteoporosis, infertility and miscarriage, neurological conditions such as epilepsy and migraines, heart disease, and intestinal cancers.
Celiac disease is regarded as a chronic disorder where the most severe symptoms typically occur in childhood and again in adult life. An individual with celiac disease will have to adhere strictly to a gluten-free diet and minimize risks of developing malignancies that are often associated with celiac disease. Those with celiac disease may develop conditions such as head and neck squamous cell carcinoma, small intestinal cancers, and non-Hodgkin lymphoma, which is the most serious complication of celiac disease. If left untreated, celiac disease can lead to the development of other autoimmune disorders such as type 1 diabetes and muscular sclerosis, as well as many other disorders such as iron deficiency anemia, lactose intolerance, osteoporosis, infertility, and intestinal lymphomas and other GI cancers. The acute issues of celiac disease would be the signs and symptoms associated with ingesting gluten products. As stated previously, these symptoms are diarrhea, abdominal pain, malabsorption, vomiting, abdominal distension, and pain.
To begin, hospitalization is often necessary when a person has had undiagnosed celiac that they have been living with for an extended period of time. The malabsorption resulting from damage to the intestinal lining causes many issues including malnutrition, dehydration, kidney problems, and electrolyte imbalances. Additionally, patients with untreated celiac are often found to have deficient levels of iron, calcium, fiber, zinc, magnesium, folate, niacin, riboflavin, vitamin B12, and vitamin D. Lacking in these vitamins can result in bone, muscle, and nerve disease that will require medical intervention. Another instance that would require hospitalization would be an acute celiac crisis. Celiac crisis is a rarely documented, life-threatening presentation of the disease which causes profuse, intractable diarrhea with severe metabolic disturbances such as acidosis and hypokalemia, along with hypotension, neuromuscular weakness, cardiac arrhythmias, and respiratory failure. In severe cases like this, the primary line of treatment would include IV fluids, corticosteroids, and gluten-free parenteral nutrition. Unfortunately for patients who experience these episodes, the diagnosis of celiac is often a process of elimination and can take multiple rounds of testing before coming to a conclusion. The extension of this process can allow symptoms to manifest and cause complications such as urosepsis and prolonged lower limb weakness due to the patient being in an immunocompromised state for such a long time. Some helpful community resources for families that have a child suffering from this disease include the Canadian Celiac Association and the Celiac Disease Foundation. The Canadian Celiac Association is a volunteer-based federally registered charity organization that provides information and support to those living with this disease. It's free to subscribe to their weekly newsletters, and their website offers multiple useful tools for people of all ages. One resource that is specifically helpful for parents living with a celiac child are the downloadable workbooks that contain information about the disease, tips from fellow parents, nutrition guides, and recipes. Also, their website has contact information for peer support groups located in each province, customizable letters to send with children to either school or summer camps regarding what their nutritional needs include, and a library of helpful videos from other Canadian families with a celiac child. Next, the Celiac Disease Foundation is an international nonprofit organization which aims to improve the quality of life for all people affected by celiac disease through funding important research, education, and advocacy initiatives. This foundation offers a multitude of resources for healthcare practitioners who work with celiac disease patients, including recommended testing procedures, the latest developments in celiac disease research, and how to monitor for gluten exposure on the gluten-free diet. Additionally, their website offers a healthcare practitioner directory, which is a free listing of physicians, dietitians, mental health professionals, and allied health providers who treat patients with celiac disease. It also provides people with the basic practice information and verification of valid license and registration of these professionals.
It is important that those with celiac disease also avoid cross-contamination of gluten, since even small amounts of gluten can lead to intestinal damage. Therefore, families must be conscious of the foods they buy, prepare, and eat. Families also need to ensure that gluten-free foods are available at social events, or they must bring their own gluten-free foods for the child to eat. Families are often fearful about eating out at restaurants due to the fact that they cannot be certain that gluten-free foods that the restaurants may offer may not be cross-contaminated during preparation. This can lead to families avoiding going out to restaurants entirely. In addition to how it impacts the family, the child themselves may experience social stigma. They may feel isolated from their peers because they need to eat different foods, and they may also feel anxious or paranoid that they may accidentally consume foods that are not gluten-free when they are at school and not around family. Families may also need to look into getting professional help to educate and support the families as they transition into a gluten-free diet at home.
Three major nursing diagnoses relating to pediatric celiac disease. First major nursing diagnosis is assessing for growth and developmental milestones. And this is important because children with celiac disease experience malabsorption in protein, carbs, vitamins, and minerals. And this can cause issues in their growth and meeting milestones compared to a regular diet child. Children can have slower stunted growth and delays in puberty, and it is crucial for nurses to monitor their growth, especially in this population with any GI-related conditions. The second major nursing diagnosis is providing diet management and nutritional education to both the parents and the child. The child is going to require gluten-free foods for a long period of time or a majority of their life, and it is important for parents to understand the consequences of ingesting gluten. Parents should have an understanding of the trigger foods and complete diet logs and teach their child as they're growing up. Health teaching should also be provided regarding comprehending nutrient labels. Parents should also be aware of the signs and symptoms of gluten ingested food as well as teaching their child these signs and symptoms. Health teaching should be provided as gluten can be present in hygienic products such as lipsticks, balms, toothpastes, and mouthwashes. The third major nursing diagnosis is administering supplements and medications as needed, providing health teaching to both the parents and the child once again. Due to the malabsorption of macronutrients and micronutrients in the small intestine, the child may require supplements to keep up with their adequate daily intake. These supplements include oral iron, vitamin D, calcium, and multivitamin. This can aid in the nutrient deficiency and growth of the child.